My name is Joshua Monreal, and my presentation is on Crohn's disease, which nowadays they just call Crohn's disease. No S anymore. All right, introduction. Crohn's disease is a type of inflammatory bowel disease, quite similar to ulcerative colitis. However, it differs in that it is not limited to the colon or large intestine. It causes inflammation and tissue destruction anywhere along the gastrointestinal tract, from mouth to anus. It is classified as an immune-related disorder, typically triggered by a pathogen, which could be Mycobacterium, Pseudomonas, or Listeria, which result in large, uncontrolled inflammatory responses. Uh, Many experts believe that it may be caused by a dysfunctional step in the immune response, resulting in unregulated inflammation, which destroys healthy tissue, as we can see here, causing painful lesions, these extended mucosal tissue lesions. Background. The etiology is largely unknown. However, genetics and family history are believed to play a role. Uh, Evidence also suggests that the condition may result from those environmental antigens mentioned before, also including drugs, toxins, or other infections. Uh, Research to date it lacks causational claims and is mostly correlational and a research tool. Pathology in early stages, inflammation may result in fever and malaise, followed by diarrhea and abdominal pain from that intestinal injury, as we can see here. So abdominal pain followed by diarrhea and fatigue and fever. As for risk factors, we're in trouble here. Young adults, ages 20 to 30, are most at risk for developing Crohn's disease, especially young adults with a history of active or recent tobacco consumption, elevated CRP or fecal calprotectin levels, deep ulcers in the GI tract anywhere, which could be caused by stress or allergies or any one of the many fun ways to damage your intestinal lining. Involvement of long bowel segments, perianal disease, extraintestinal manifestations, or a history of bowel resections. Fun, fun. All right, current knowledge and treatment. The main nutritional advice given to people with Crohn's disease is to avoid common food triggers and to tailor to the patient's current gastrointestinal function, all while increasing antioxidant intake. Now you may be wondering what some of those food triggers are. They are going to be your foods high in insoluble fiber or high fiber containing foods such as Brussels sprouts, cabbage, cauliflower, asparagus, as those put a lot of stress on the lining. Lactose containing foods, so not only are lactose intolerant people needing to watch out for milk and dairy products as we approach Christmas time, but so are our friends with Crohn's disease. People with Crohn's disease are going to want to avoid foods with high sugar contents or added sugars, such as cookies, pastries, and sodas, which only make this time of year so much less fun. Those artificial sweeteners that we see in the zero-calorie options, those will also put quite a bit of stress on the lining of um, our intestines and system as a whole. Also, high fat foods. So those are going to be butter, cheesy dishes, fried foods, and finally, to avoid caffeinated beverages such as tea or coffee, and especially those energy drinks, as we've been talking about before. Nothing good about those. All right, supplementation. Some experts think or believe that there are benefits with supplementation with omega-3 fatty acids and glutamine and the inclusion of pre and probiotics. And moving on into healthy habits to help mitigate Crohn's disease, and especially when working towards remission. We're going to want to encourage our young adults to quit smoking or use of tobacco products in general. People with Crohn's disease are typically going to have more success with smaller, more frequent meals as opposed to the large 3 meals a day that many of us eat. We're going to want to encourage hydration and staying on top of that. Managing stress to cut down on the possibility of developing the ulcers in the first place. And sleep, sleep, sleep. Sleep is the best way to repair our bodies. And so, as with anything else, we're going to want to prioritize sleep in our patients to help them to overcome this disease. Unfortunately, here, let me go back here. My sources. There is no cure for Crohn's disease except for removal of the section that is affected, and then some sort of bypass system would need to be installed or a workaround. And that's pretty much it. So the only way to truly cure it is to cut it out. Otherwise, we can help mitigate the symptoms. And here's some of our references. All right. Thank you so much.